So your practice at Georgia Hormones, what does that include for our patients with PCOS?
Well, about what PCOS is in the first. Usually, women find out that there's something with their cycles fairly early on in their lives.
Mm-hmm.
They may be having irregular periods. They may be skipping periods. They could even have occasionally heavier periods. If later on that individual is trying to get pregnant, they might find that despite the fact that they're having sex on a regular basis, that the pregnancy doesn't occur. So in that case, PCOS might be, there's really two separate, one of them is an inborn control mechanism in what's controlling the periods, and the second one actually is a woman that has a tendency toward physiologic causes for polycystic ovary. IGF is similar in structure to insulin. So at the beginning of her cycle, the brain is telling the ovaries to start to make hormones. And when the theca cells in the ovary get this message, they are actually stimulated by other cells in the ovary making insulin-like growth factor that is stimulating these male hormone-producing cells to make the male hormones. And then those male hormones.
Wow.
So if that individual
big transition process.
Yes.
To say who has the facial hair and who has acne and help that?
That's not so much in foods except for lowering the amount of sugar, basically. Mm-hmm. So as far as the body is concerned, bread, potatoes, they are all turned into sugar. So white bread is basically the same as drinking Coca-Cola as far as the body's concerned.
Wow.
Some carbohydrates are much harder to break down. Oatmeal would be somewhat slower than eating a piece of white bread. But interestingly, you can have different women which even have the same blood male hormone levels, and depending upon their genetics, their faces, the skin on their face and the hair follicles on their face may be more sensitive to the male hormones or less sensitive. So some women at the same testosterone level may get acne and facial hair, and other women won't. There are some drugs that can block the male hormones from getting to that area, so that can help relieve the facial hair. But usually the two things that we're trying to do is either, number one, getting the pre-diabetic patient to change her diet. If she really reduces the amount of carbohydrates that she has coming in, then she'll have less insulin, and that's really solving the problem on the front end. Part of this research has really been driven by companies that make diabetes drugs, which also lower insulin levels. But the diabetes side effects to the patients. So
because they're only covering that one aspect of diabetes.
Right. So really I'm trying to solve the problem, and if I can get the patient to change her dietary habits. One of the interesting things about diabetes in America just in general, though, is we've only been drinking huge amounts of Coca-Cola and some of the other sugary stuff. It really got much worse in 1981. That was the year that Coke and Pepsi changed from using cane sugar to using high fructose corn syrup. And
Hello, I am Iesha Westmoreland, and I am unveiling my PCOS struggle today. Usually I keep this in. I don't like talking about it, thinking about it, looking at it. But if I am a PCOS philanthropist, then I do have to let the people that I am trying to fight for see my struggles out of it as well. So usually I get all dressed up and, I have full face of makeup or whatever. But today I just have some eyeliner, mascara, and lipstick on. and I am letting you see my horrid PCOS struggle. I struggle with this every day, and it's pretty much been there all I can remember. It's my biggest struggle as a PCOS warrior, along with the having trouble conceiving. Those are my two main problems that I've battled most of my life, or probably the entire time I've been diagnosed with PCOS. But yeah, I just wanted to let you see me as I am. This is my PCOS struggle. And I hope if somebody else is going through this and they see this video, that I can give them the strength and the courage that they need to succeed and thrive in this world. Because I know for me, it was hard for me as well. So I just thank everyone for tuning in with me today. And I thank you all. I humbly thank you for allowing me to unveil one of my deepest, darkest secrets and one of my deepest vulnerabilities. So thank you. Continue to follow.
Well, I'm pretty sure I've had PCOS my whole life. I kept getting misdiagnosed with just depression. I knew that there was something wrong for a while, just my body not feeling right, constant fatigue, chronic pain. They would just tell me it just is what it is, it just is what it is. But no, I just kept on persevering. I had just so many different symptoms like weight gain. Even if I worked out a lot, I would eat right, irregular cycles. So that's really kind of where it started, was just kind of knowing for a while like something was not right. I'm going to gain weight. So it's kind of one of those catch 22s where it's like, okay, well, I'm not going to eat. Like I was anorexic when I was younger, because when I would eat, I would gain weight. And being young and naive and not knowing any better, and wanting to be pretty, that definitely caused a lot of, I think, mental issues and body dysmorphia, and not having a period. Like I already knew for like I said, I already knew for a long time that my body was just not right. It was just different. Like I just noticed between other girls that my body would just be actually heal my body altogether, not just, the period, or not just the insulin resistance, but in regards to like inflammation. There's a lot of studies and research that show there are foods that can help with inflammation. Of course, there are foods that can trigger it too. PCOS, because I'm so early into having the diagnosis, that I don't have enough proof or evidence. I'm not that far along after the diagnosis, so I'm still in the process of picking my feet up and trying to move forward. So my main focus is on really my body in regards to losing extra weight that I have. I have high cholesterol right now. That is my main concern.